Good afternoon, people of British Columbia. Woo! And welcome to all of our virtual viewers that are watching from all across Canada. We are so glad you could be with us today. I'm thrilled to see so many people here because this is what grassroots activism is built on. The people coming together for a worthy cause. It also demonstrates how dire this situation is and how desperate the people of BC truly are. My name is Camille Curry, and I am here today to tell you the advocacy work that BC Healthcare Matters is doing is having an impact. But we must increase the pressure on this government, and we need your help to do so. We've all come here today because we want timely access to a family doctor. This shouldn't be too much to ask for. But in BC right now, this is not a guarantee. It's actually more like a distant dream for most. But I do not accept that. Do you? No. Do you? No. I do not accept that this crisis cannot be addressed until we receive more federal money. I am angry that the government of BC barely acknowledges the pain and suffering of the people that I hear of every day. I am frustrated that the health minister will not answer questions with anything other than stats. I am gobsmacked when I hear our premier and health minister tell the people that they are taking positive steps towards addressing this crisis, and yet the number of unattached people continues to rise. In fact, let's do a quick recap of what healthcare actually looks like in BC right now. Over 1 million residents do not have a family doctor. 68% of the West Shore communities are without a family doctor. 40% of Kamloops is without a family doctor. 25% of Victoria Metropolitan is without a family doctor. We have 64 vice presidents and 6 health authorities earning an average salary each of $390,000. Whereas our neighboring province with a similar population has only 7 VPs. And in case you were wondering, that's $25 million a year spent on bureaucrats. That is $25 million a year that is not providing family doctors to residents in BC. Victoria has the longest wait times in the entire country for walk-ins. And let's be honest, that's only factoring in the lucky few who actually get seen that day, not those that return day after day hoping to become one of the few that could possibly wait up to 161 minutes to be seen. Is this acceptable? No. Urgent primary care centers across our province last reported being at an average of 53% fully staffed. Are we to be impressed by this? No. There are 0 walk-in clinics in many communities, including the entire West Shore with a population of 88,000 people. Hospitals have shut down for consecutive days, leaving rural communities with no acute care or primary care. Is this what you expect from your government? No. You've all heard it in the news. We have a nationwide healthcare crisis. Oh, does that mean that we should do nothing just because these are nationwide problems? No. No. It doesn't matter if you want to call this a provincial crisis or a national crisis. It's affecting you and me. And so we must act together. Our already strained hospitals are further strained by having to provide primary care services too. Our specialists are unable to take on new patients as they have no one to discharge to. This cannot go on because our system will not survive. It is beyond bad. It is beyond critical. We are in the downward spiral of full collapse. Imagine if we all woke up tomorrow and didn't have a family doctor. While this may seem to you like a distant possibility, I'm telling you right now today that this could be a near reality for all of us. Without the care of a family doctor, how many of us will die sooner? How many of us will see a reduction in our quality of life? How many will never have diseases caught in time for treatment? Too many. That's how many. Because even one is too many. Some of you may feel you don't need a family doctor. But will you need access to a hospital when you have a car accident? Because that will no longer be there without our family doctors. Some of you think the government will get this fixed on their own. To that I say, show me the track record that leads you to that conclusion. Others may be thinking, but what can I do? I'm just one person. Well, let me tell you something. We're all gathered here today because of the power of one that grew into the voice of many. 9 months ago, I decided that enough was enough, and I would take a stand. Will you take a stand with me today? Hopefully, you are here today because you have come to the same conclusion as me. If we don't speak up, if we don't advocate for our right to access primary care, we will see more of our family and friends die. To the family doctors in the crowd today and listening at afar, hear me now. Your role is so incredibly important. And I am sorry that that has not been acknowledged to the degree that it should be. But like many of the most important things we have in our lives, we don't appreciate them fully until we no longer have them. October 31st will be 3 months until the government's support funding to family doctors runs out. So here's what I know. If this government and the organization Doctors of BC does not present our family doctors with an equitable compensation option by this date, we fully expect to see a mass exodus of doctors from British Columbia. Practices are required to give 3 months' notice before they close. Therefore, those letters will start to roll out on October 31st if the right options are not proposed by then. Are you willing to let that happen? No! Because what do we want? Oh, they didn't hear you over in Vancouver. What do we want? Doctors. And when do we want them? Now. So what do? We rise up. What I have learned is that if you want better health care for you, for your family, for your community, and if you want to be treated equitably in your profession and as a resident of BC, then you must rise up and demand it. We advocate because no one else is going to do it for us. Wishing for better outcomes will not be enough. So we must use our words, our stories, our skills to inform the entire province, the entire country, about why everyone having timely access to a family doctor needs to be the #1 priority. We advocate for the seniors that can't do it for themselves. We advocate for the unborn children that do not even know how much they will need you. We advocate for an equitable system. We teach our children to stand up and speak up when they see bullying occurring or human injustice. Well, guess what? That's what this is. If we wish for the children of our world to stand up to injustice, then we must lead by example. I am Camille Curry, and I hope you will support BC Healthcare Matters, because everyone deserves access to a family doctor.